think about emergency medicine. Everybody thinks about the cardiac arrest and the trauma. We'll talk about this in the next two slides. Cardiac arrest is not always that successful. The out-of-hospital cardiac arrest survival rate is about less than 15% overall. The in-hospital cardiac arrest is 22%. Now, there's shockable and non-shockable rhythms, and you can divide them up. The shockable rhythms have a higher survival. The non-shockable rhythms have a lower. On the average, is 22% in the hospitals, surprisingly. Now, in the ED, I don't have any statistics on in the ED, but I can tell you my own experience is much, much higher. And that's one of the beauties of emergency medicine. People come in walking and talking, and then they can go to, if they go into cardiac arrest in the ED, we're much more likely to save them. We're watching them more closely than they're watching the floor. The floor they may have a nurse checking on them every hour or two, and the patient, I've gone up to the floor to do resuscitations many times, and you get called to the floor in the hospital, and the patient's unresponsive, and I say, or pulseless. I'm like, what happened? Well, I don't know. We just walked in, and the patient was, either not breathing, or there's no pulse, or when was the patient last seen? We saw the patient 30 minutes ago or half an hour ago, checked on him. She was doing well. He was doing well. Whatever. Also, the ICU patients are sick when they go in there to begin with. So the cardiac arrest in the ICU has also not a very high success rate. But people come into the ER. We have all the equipment. We have all the, this is what we do more often than most people. We're the experts in resuscitation. So you come into the ER with your cardiac arrest, you have a very, very high likelihood of survival. And I can say, if just thinking off the top of my head, I think that every case I've had that has gone into for sure a shockable rhythm has survived. Every case that I've been involved in, and the non-shockable